Welcome back. November is National Diabetes Awareness Month. A timely topic given that most of us just ate a ton of candy over the weekend. Not me, though. Naturopathic Dr. Olivia Rose joins me now with a few remedies to keep your health in check. Welcome back.
Thanks for having me.
Oh, my goodness. We need you. Believe me. I mean, Halloween is over, but there's still some candy to deal with.
Yeah.
And so because we've got National Diabetes Month, we need to talk about how we can keep our health in check. So how do we do that?
Yeah, so there are three main types of diabetes. Type 1 diabetes is when your pancreas doesn't produce any insulin at all. And insulin is that hormone that helps your body to regulate the sugars that you take in once you absorb it, the glucose, into your bloodstream. And then you have type 2 diabetes, which is when your pancreas isn't producing enough insulin, or there's an insulin resistance, so your body is not responding well to the insulin that's already in your bloodstream. And then you have gestational diabetes, which occurs during pregnancy, where your body is just not able to produce enough or handle the extra demand of carrying a baby and the hormonal changes that your body's going through. So the first thing that I like to discuss with patients is exercise, because exercise can help you if you're dealing with either gestational diabetes and you have an exercise routine during your pregnancy,
Sure.
or type 2 diabetes. It helps your body to respond better to the insulin that's in circulation by increasing the insulin receptors. And in one study, exercise for 4 hours a week actually decreased your risk, I guess,
Right.
by 80%, even though the people in the study didn't actually lose any weight. So exercise can be very beneficial, because what it does is your muscles are just going to take up that extra sugar and use it up.
So it regulates this type of diabetes, and with exercise, just a minimal amount can make that change.
Exactly. You don't want to go from 0 to 4 hours, but
Sure.
just start to incorporate more exercise in your life.
And any kind of exercise that elevates your heart rate?
You want to do a combination. So cardiovascular,
Right.
walking is a wonderful place to start, but going into the weight-bearing exercise is also really awesome, using the weights, doing squats, doing things like
Building
that.
some muscle.
Building some muscle can be
okay.
very helpful.
Okay, all right. So exercise is
Yes.
first and foremost a really good way of at least regulating or decreasing your chances of getting diabetes.
Exactly.
What else can you do?
Apple cider vinegar, one of my favorite
Really?
things. It's so nutritious, and adding it to a salad before your main meal can help increase that insulin sensitivity to help your body respond to that insulin better. It's just adding 1 to 2 tablespoons.
That's it?
Yeah, with some olive oil,
Sure.
Salt, pepper, that kind of thing, and add it to your greens.
So does it absorb a lot of the sugar as well, or it just simply stimulates that insulin that you're...
Basically,
Okay.
yeah, it's just helping your body in its response to the sugar that you are absorbing into the bloodstream.
Okay,
Yeah.
apple cider vinegar, got it.
Yeah, and then we have cinnamon. Cinnamon is another wonderful a tip to add to your daily routine if you're at risk for diabetes, because about 1 gram can help to reduce the fasting sugar in your bloodstream, but also your cholesterol and your triglycerides, which also can, I guess, be correlated with elevated blood sugars as well. And 1 gram is
1
about,
gram?
yeah, it's 1 gram. It's about, yeah, 1/5 of a teaspoon.
Oh,
Not so
okay.
much, yeah. And then just
okay.
sprinkle
Just
it in
about
your
that.
smoothie, in your coffee, in your tea, on your oatmeal, just throughout the day, and it can also help. It's very potent, it's wonderful, and it tastes great too.
It does. Now, could you put 1 gram? Is that too much to put all in one in a drink, or do you have to split it up?
I find for myself, I think it's preference, but I find for myself, if I put too much, it gets a bit bitter.
Okay.
So you want to maintain the nice taste of cinnamon.
Sure.
So I'll put it throughout the day. Maybe I'll put some in my smoothie in the morning, in my oatmeal, that kind of thing.
And in your practice, is there anything wrong with having cinnamon every day in that quantity?
No,
Okay.
no, it's perfectly fine. They've shown that it can be really
Okay.
helpful in studies.
All right, what else do you have?
We have honeybush. So this is a tea that's indigenous to South Africa, and it's loaded in nutrients: potassium, calcium, magnesium. I actually made you some.
Great, thank you.
And it's wonderful for reducing that fasting sugar and for helping your body to burn fat. So it's actually great for boosting up your metabolism.
I'm going to have some of that.
And
now,
it's
where
naturally
can you,
sweet.
Really? Now, where can you get this?
Most
this type
health
of
food
honey?
stores,
Oh, really?
honeybush, yeah, most health food stores will have it.
Okay.
Which is wonderful.
Oh, that's great. And then finally, I know you're taking a sip there.
Yeah.
What's your last
We have
remedy?
alpha lipoic acid, or ALA.
I'll say
ALA, it's an easier way to say it. And basically, it's an antioxidant, and antioxidants help to protect your cells from damage. And with prolonged diabetes, or if the diabetes isn't under good control, that extra sugar can cause damage to your nervous system, to your cardiovascular system, leading to the burning and tingling in your extremities, so your fingers and your feet. And ALA is awesome for helping to treat that damage, and it's also great for increasing that insulin sensitivity again.
And you can find that at your health food store.
Yeah, health food stores have it as well, about 200 milligrams up to 600 milligrams a day, depending on the patient.
Naturopathic doctor, Dr. Olivia Rose. Cheers. Thank you so much.
Thanks for having me.
And we'll see you again soon.
Yes, for
Thank
sure.
You.